it's still imperative and essential that you do wear gloves. And here we use vinyl gloves. Now, let's face it, they're a lot cheaper than the nitrile gloves. We use them for classroom purposes. Okay. But if you have any dermatitis problems, let me know, then I'll get you some nitrile gloves. Okay. So in here, we always wear gloves for each scenario. Have a really good view of what's going on. Very important that you watch demonstration. I'm going to, so every helper that you have is an untrained helper. So AJ here is going to be my untrained helper, assuming that he's never taken a course before, and so I have to give him some good direction. And you actually get marked on that when giving directions to your helpers. So the way this works is we do a lecture and I introduce some stuff to you. So I introduce the priority action approach, and then I do a demonstration. I do it at quick speed, and for the majority of the time, not always, I will break down the demo for you. So I'll go through it fast speed, and then I'll break it down, explaining things. And then at that point, after the explanation portion has happened, and then I'll open the floor for questions. Are you okay with that? Okay. So we're looking on the board here just in case, and you want to get a better view of the priority action approach. So I've done kind of a modified version of that. The scene assessment, so it's for us to check out the scene. So hazards, H, M, and number, hazards, mechanism, and number of patients. So there is no hazards, the area is safe here. What has happened here today, Kevin is on a construction site, and he's taken a fall about 2.5 meters off the ground, so about 6 to 8 feet off the ground, and he's hurt his leg, and he's hit it on a concrete block. Okay? And he did take a free fall off that height. So we definitely suspect A. Okay. And he's got a small amount of blood, and he is responsive. Head is to the right. Turn your head to the right there, Kevin. Thank you. Okay. So due to the mechanism of injury, we suspect a spinal. And as I approach my patient, I notice that my patient's head is to the right, his skin color is normal, he's talking, and there's a small amount of blood on his leg there. Kevin, stay still, don't move, it's Tommy, I know first aid. Please don't move your head or shake your head, just tell me verbally. Is it okay if I help you out here?
Yeah,
okay.
Yeah, please.
My patient's airway is clear. Hold on your head here, Kevin. I'm going to realign your head. If it hurts, let me know. If there's resistance, I'll stop. Do you understand that?
Yep.
There we go. Just going to gently pull and realign it. With me there? Slightly tilt it back towards you so you're looking towards the ceiling. There you go. You okay with that?
Yeah.
AJ, can I please get you to come over here on my left side? I want you to put your left elbow down, next to my left elbow, please. Put your hand over top of my hand, try to cover his ears, thank you. And now put your right elbow next to my right elbow. Hold his hand, hold his head. You got it? Good, you've been there for a while, so you comfortable? Okay, the airway's clear, my patient's talking to me. Check my patient's breathing rate. Looking at my watch here and watching his chest, or looking at the clock. You're doing well here, Kevin. This is just my leg that hurts. Deep breaths. Okay, 5 times 4 is 20 and effective. Radial pulse. Be good. Skin color is normal color and it's warm and dry. Kevin, did you hurt yourself anywhere else at all?
Just my leg.
Check out your scalp here. Any pain or numbness or tingling in there? Any pain or numbness tingling in your chest or your back here? Okay, you're sure about that, right? No pain or no numbness, no tingling, right? Any pain, numbness, or tingling in here? Any pain, numbness, or tingling in here? It says, oh, it hurts right there.
Oh, yeah. Oh.
Is it pain or numbness or tingling? It says it's just pain. You feel me touching you down here?
Yep.
Any pain or numbness or tingling in your arm here? See the blood on my hand. Any pain, numbness, or tingling on that arm? Okay. So we'll get a bystander to go update 911, tell them our patient is stable and they're non-RTC. Update's done. Maintenance consists of blanket and oxygen. Enter an option on tomorrow. Not for me. Oxygen. Now I'm on my secondary, and I'm going to do it here in the field because he's not RTC and stable. So, AJ, you can sit up. Kevin, stay there, please. Okay, so I'll do a breakdown. You want to go, Kev? Okay. So head to the right, please. So this patient here has taken a fall. That's what happened. One patient of hazards. So we know that they're going to be suspected spinal due to the mechanism. So as I approach my patient, always wait for me to tell you what they look like. It's important that we see if their eyes are open, skin color, and any blood. 3 main things I always look for. Upon approach, notice I approach him from here now. Kevin, stay where you are for a sec. Keep looking that direction. If I approach Kevin from the wrong side here, so when I call your name, turn your head towards me. Hey, Kevin! Let's try it again. Go ahead.
Okay.
Hey, Kevin!
Ah!
So if we did have a suspected spinal injury, then I would have aggravated it, right? Well, let's try it again. I approach him from the side that he's looking at, right? So this is his line of vision. Stay still, please don't move. And sometimes I even go so far as saying, because they'll say, okay, don't move your head. Okay, I won't. Well, can I help you? Yes, you can. And so if they have an injury, sometimes you have to seriously go so far as saying, stay still, don't even move your head, don't shake your head. I know first aid. Just tell me verbally, is it okay if I help you out? Yes, good. So then, once you got permission, top of their head, and now you know the airway's clear as well. Notice my elbows touch the ground first. I'm going to hold the head from the side here. I want you to do a gentle pull and realignment. So it's not like you're going to just gently hold your head. I'm going to realign your head. If it hurts, let me know. Resistance, I'll stop. Do you understand that? Yep. See, notice I told him first before I realigned it. I didn't just come and go, I'm going to realign your head. If it hurts, let me know. You know that. So you got to finish off your sentence first. You need to make sure they understand. So you realign your head. If it hurts, let me know. If resistance, I'll stop. You okay with that? Yep. So this chin in the middle is called anatomical. Put your head back towards me. This is called neutral. When you hand off the head, AJ Chameleon. Notice elbows are both on the ground. Put your left elbow next to my left elbow. Okay. There you go. Now look, still 2 elbows on the ground. Now right next to my right. You get a good hold? Yeah. At all times, there should be 2 elbows on the ground when you hand off. Now you go down here, time the breathing rate. You know, you can use 2 hands if you like. You can use 1 hand. As long as you get a good visual where what's rising. Some people breathe through their chest, some through their stomach. You know, you shouldn't be doing this sort of stuff. You can go on their ribs, diaphragm, or stomach area. Don't make them feel uncomfortable, folks. Look at it. Every time it goes up and down, that's 1 breath. And you're going to time it for 15 seconds. Whatever number you get, multiply by 4. And the breathing rate should be what? 10 or more. no distress. So over 10 and effective. Now when you're checking the pulse, you're looking for signs of shock. Are you timing it or just looking for the presence?
Just looking for the presence.
Yeah, so pulse is there, out of the beat. Beat. Heaven. I remember having this problem with you before too. There you go. That's there. Just a little digging in there. Skin color. I remember you, man. Right, then after the skin color temperature, then you do rapid body. Notice the rapid body, this is the main reason I do this again. Rapid body is scalp. Look at your hands. Underneath the neck. Your hands. Any pain or numbness tingling? Once again, look. Middle of their chest. I'm sorry I have to say this, but last week I had somebody go there like this. Like everybody, girls and guys, and it's like, they weren't like being perverted. They just didn't have a filter, man. Like just have this like, it's like people are like, what are you doing, man? At first it was funny for them, and then after it's like, whoa, like, you chill out with that. So, sternum. You can actually sit up, bro. We're gonna be doing AJ sitting there the whole time first. And then up, down here, look underneath the back. Look at my hand. This is pretty quick. It's actually only 30 seconds. Any pain or numbness or tingling in here? You know, notice I don't just go like this. It's actually up and around, up and around. And looking to make sure you're not hurting anywhere else, okay? Ow, anytime he says ow, as long as it's a little bit of blood or a deformity, as long as it's not a massive bleed, like heavy pooling, all you gotta say is it heavy pooling? No, this is my helper. Helper, hold above and below the injury like this. Elbow stable. That's this person here. Don't lift it and put it underneath. You'll aggravate it. So it's actually, this is a person, right? What are you noticing I'm doing all the time?
Checking for blood.
Any pain or numbness or tingling. So I'm always asking, I'm always looking. I'm looking at their face too. You know, sometimes they're unresponsive, like as soon as you touch like their sternum, go. You know, so you can see from their facial reactions where the injuries are as well. Okay. Thank you, sir. You can leave that tape on there to remove using. Okay.